Hey squad, welcome back to my channel. If you're looking forward to vlog 7, I'm so sorry to disappoint you, but this will not be a vlog day. I'm doing something special for the newbies everywhere I look, whether it's on my Instagram, in the Body and Facebook group, just everywhere in the community. I see people who don't know what certain acronyms are. And recently I saw someone say, what is BBL? Which I probably think is the most common acronym in the community, but maybe it isn't. Some people don't know what BBL is. And then when I see people asking me, what is SX? When everything's body MSX, I'm like, I need to address this. SX is surgery. So let's get right into it about these acronyms and these terms that you may want to know. We are going to start with BBL, which is a Brazilian butt lift. BBL is usually lipo, LS or liposuction, combined with the FT, a fat transfer. So they lipo usually 360 degrees around your torso. So you hear the term lipo 360, and then they transfer that fat into your butt. Now I want to note that lipo 360 in the States is typically around your torso, but if you're abroad, that 360 could include both arm and or thigh lipo. So just specify with your doctor if you guys have a plan to do any type of lipo 360, which areas are included in that 360. With that, there's the BFT, a breast fat transfer. Now I don't see that one often. Not many people have done it. I've been using BFT just because I'm quick. I'm from New York. You know, we like everything fast. But I think people use it. So BFT is breast fat transfer, which I think I should do a video about my breast fat transfer. If you like that, let me know down in the comment section below. There's BR, breast reduction, BL, breast lift, BA, breast augmentation, AR, areola reduction. Back to lipo. There's AE, abdominal etching. You guys familiar with abdominal etching? Flanks. I want to talk about flanks. Flanks are your love handles. So usually if you were to get a TT, tummy tuck, flank lipo is usually included in a TT, a tummy tuck. Your surgeon will likely pair that tummy tuck with 1,000 cc's of flank lipo, 500 cc's on each side most likely. That just means they're going to lipo your love handles to give you a nice contour with that tummy tuck. Now, of course, I'm not talking about a double board certified plastic surgeon who's working in the hospital. They may take more. There's a MTT, which is a mini tummy tuck, ETT, extended tummy tuck, FTL, fleur de lis tummy tuck. There's all different types. If you want me to make a video about that or any of the stuff that I'm touching on, please let me know in the comment section because I would love to elaborate on some of these terms. I just wanted to sort of touch base with them and let you guys know what they mean. So if you're having a conversation with your surgery sister, something I'll talk about as well, you know what she's talking about and you can relate to her and you guys can speak the same language. Included in the tummy tuck is usually MR, which is muscle repair, and there may or may not also be HR. Last procedure that I had a tummy tuck with MR and HR. You guys probably saw that in the title and maybe you didn't know what that meant. I said I got a TT with HR, MR. Let me tell you what I meant. Tummy tuck, hernia repair, muscle repair. You may see people saying diastasis recti, which is referring to the muscle separation, which only a tummy tuck with muscle repair can address and fix. With that tummy tuck, you're probably gonna get a new BB, and maybe it's a new baby when you get home. You know, you might get a new BB, who knows? But BB is belly button, right there on your ABD, abdomen, okay? That one we don't see often, but just letting you know, ABD, you may see. Lipo removes fat, not skin. Let's get into some of these other lifts, which are skin removal procedures, right? AL, arm lift, TL, thigh lift, MTL, medial thigh lift. Oh, also LBL, which is a lower body lift. So those are all some skin removal procedures. And with that, we can go right into BMI, body mass index. So you hear a lot of people like, my doctor wants my BMI to be under a 35. I won't get into this, but just know that BMI is very, very important. And a lot of surgeons have restrictions on how high they'll go as far as BMI. You may try to lose weight to get your BMI, your body mass index, down. And you may do that with EF, extended fasting, or IF, intermittent fasting. Those are options, EF and IF, all while tracking your weight. There's a there's SW, starting weight, CW, current weight, GW, goal weight, SXW, SX surgery. Wait, SX is surgery, guys. Sodium SX. SX is for surgery. RX for prescription. TX for treatment. I don't know if it's interchangeable, but let's just say therapy for the sake of this video, because I don't want you saying she said it was for treatment. Do you guys believe that? And there's THX, which is also for therapy, but if I saw somebody say THX, depending on the context, I might think they were saying thanks, and I might write back, YW, you're welcome. You know, who knows? So think about the context that you're seeing some of these words in, because it might be an abbreviation just for, you know, some long form word, or just any word, because you guys know we're in a microwave society and we want everything fast, and we can't even write out the word thanks. Meds, people are abbreviating medication. CG, not the clinic, referring to CG, compression garment, more commonly known as faja, the Spanish term for it. There's MLD, manual lymphatic drainage massage. LDM, lymphatic drainage massage, which may help the swelling in your fupa, fat upper punani area. Just throwing that one out there, because people say it all the time, and some people are like, what the heck is a fupa? And some people might tell you it's fat upper, I don't know what they say, but to me it's punani. Fat upper punani area is your fupa, okay? Which does swell after your SX. I'm gonna get some tissues, because no, I don't have the corona, but something's going on. I'll be right back. ABPS, the American Board of Plastic Surgeons. AACS, American Academy of Cosmetic Surgery. You may see someone say they're a FACS, a fellow of the American College of Surgeons. I won't get into that. If you want me to do a video explaining board certified versus non-board certified, double board certified, what those terminology means, let me know. And let me know if you want me to do a video going in more details about plastic surgeon, cosmetic surgeons, doctors, who's allowed to do surgeries, and all of that stuff that I won't get into right now. When it comes to surgeons, you may see PS, plastic surgeon, DR, doctor, DRA if it's a Spanish female doctor. DR could also very well mean Dominican Republic. You may see CO for Colombia. You may see MX for Mexico. You may see MIA for Miami. I won't go on, because I'm not going to turn this into a geography lesson, you know. Those are the ones we see, I would say, the most often, especially in my group, which is for all women, regardless of who your surgeon is, where you're going for surgery. And I won't make this a medical lesson either, but I have to say you may see HB or HGB for your hemoglobin. A lot of people know that they have to have their hemoglobin at a certain level in order to be cleared for surgeries. Ask your surgeon what their requirements are for you to meet, but I will say a standard is about a 12 for a single procedure and above 14 for double procedures. So you probably see people talking a lot about their hemoglobin levels. You probably want to stop your BC, your birth control. But again, talk to your surgeon. Your sisters are probably referring to birth control when they say BC, or they could even be talking about a blood clot, which is a risk with surgery. So you may see BC written as blood clot. You may see PE, pulmonary embolism, which is another concern after these elective procedures. If you're pre-op, it's before your surgery. If you're post-op, it's after your surgery. There's a lot of time references with PO, so you may see MPO, DPO, WPO, you know, for months, days, weeks, post-op. People usually say, you know, days or weeks. We don't really see months. And we're talking after around. Around just means that you've had surgery. Last year I had around in DR. Round just means surgery, a procedure. With that, you may hear the term hybrid often, and no, we're not talking about a Prius. Hybrid is someone who's been to more than one surgeon, so you probably see the term hybrid often. Or vet. Well, it depends who you're talking to, because some people might say you're only a vet if, you know, you've had surgery more than twice, or you're only a vet if you've had a complication and had to deal with it, or you're only a vet if you've been to more than one place, or you're only a vet, who knows. If you've had surgery once, in my mind, you're a vet. You've been through this. You can speak from experience. That makes you a vet. Depends on who you're talking to, but a vet had at least one surgeon, one doc, and then it's at the person's discretion. Hey doll. Hey doll. I don't like the term doll. You know, the community refers to us as doll. Personally, I don't see myself as a doll, although I can be sweet sometimes. We've all heard the term doll. Oh, my dolls. Oh. Your surgery sister. Your surgery sister is someone that you plan your surgery with, and it's usually someone that you choose to recover with. You guys at least will likely stay at the same recovery house, or RH, right? After surgery. People say, I see you on the flat side. A lot of people are like, I've seen this come up so many times. Why do you guys say flat side? It reminds me of flat lined, and I'm getting rid of my flat booty. I don't want to be on the flat side. It just means your stomach's flat. That's where the term came from. I prefer snatch side, but this people might say snatch, like somebody snatching your soul. I don't know. I prefer snatch side over flat side. I just say, you know, I'm happy for you, happy healing. I'll see you when you wake up, honey. But you guys do see flat side, right? Lats, hips, slope, shelf. Oh my God, I could go into this. I should do maybe a whole video on this. You guys tell me if you want me to do a video on butt shape. Lats are usually paired with the shelf booty. Hips are usually paired with the slope. I did make a post on Instagram. You guys can see a little bit, you know, the difference between lats and hips. But if you want me to go into this in more detail, again, let me know in the comment section below, and I can make a video going in more detail about lats, hips, slope, shelf. My website, if you're traveling to DR, book overnight nurse, and I have her listed as overnight nurse / private duty. Typically, your overnight nurse is going with you into the clinic, staying with you overnight to be there with you during your most vulnerable time right after surgery. And then if you hire that nurse for private duty, separate from the clinic, you may decide I'm going to stay at a hotel. You hire that private duty nurse. It's all the same thing. It's sort of interchangeable, but you hire that nurse to help you and to work with you privately after your surgery. CC. So CC could be capsular contracture. CC or CCs normally are referring to implant size or cubic centimeters. CCs are typically used because fat is solid and not liquid. So your CCs could be how much was removed, how much was injected. For instance, when I had surgery in Miami, they removed 4,000 CCs total, and they put in 2,000 CCs on each side. So in each butt cheek. There's double board certified surgeons who work in hospitals who can do more. But typically, if you're going to Miami, a Miami clinic, just know the max is usually 4,000 cc's that they can remove, which means the max, you know, considering all viable good fat, would be 2,000 cc's in each side. That's pretty much it. I'm sure there's so many more terms. These are the ones that I think are the most common and at the top of my head, and I wanted to go ahead and fill you guys in so you guys can talk to your surgery sisters, speak to the community, and feel well informed. Speak this surgery language with us all. Not sure if next week I'm gonna go back into my vlogging or if I'll do another informative video. I seriously want to know what you guys prefer and what you want to see me do more of. So please let me know in the comment section down below. Please go ahead and like my video, subscribe to my channel, and I'll see you guys next week at the same time. Oh, extended fasting. You know I ain't fasting, so I'm like, what was the other one I knew I had to bet to? No, I'm not fasting nothing, okay?